Welcome to The Explainer. I am absolutely thrilled to have you with us today because we're looking at a truly fascinating, state-of-the-art review recently published in eFort Open Reviews. Today, our explainer is focused on osteoarthritis, but, not in the way you're probably used to hearing about it. We are exploring a cutting-edge orthobiologic treatment called intraosseous platelet-rich plasma, or IO PRP. It's a therapy that is literally changing how medical professionals understand and treat severe joint pain. Let's get right into the science and see how this revolutionary approach targets the very foundation of our joints. Okay, let's dive into this. If you, or maybe someone you know, has severe joint pain, you've probably encountered this super frustrating reality. Why do standard joint injections eventually just fail to provide lasting relief as the arthritis gets worse? It's a central medical mystery that we've struggled with for a long time. Well, it turns out fixing just the cartilage on the surface simply isn't enough. So here is a quick roadmap for our scientific journey today. We're going to start with a macro problem of the joint pain epidemic and then uncover the hidden bone culprit. From there, we'll explore the deep bone solution, zoom into exactly how IO-PRP works on a cellular level, examine the clinical evidence, and finally, look at what this all means for the future of joint care.
Let's start with Section 1, the joint pain epidemic and its growing burden on both aging adults and athletes alike.
To put this epidemic into perspective, here's a crazy fact for you. Your knee joint routinely absorbs forces up to 6 times your body weight just by walking down a single flight of stairs. Over a lifetime, that is an unbelievable amount of stress. And the frustrating reality is that our standard conservative approaches usually just fall short. Traditional treatments like pills, physical therapy, and standard intra-articular injections, which go right into the joint fluid, often only provide transient, temporary relief, especially as the disease progresses. We've been trying so hard to treat the problem, but we keep hitting a wall. Which brings us to Section 2, the hidden bone culprit, deeper than cartilage. Let's play medical detective for a second and introduce the real biological reason behind this severe joint pain. The answer actually lies much deeper than the cartilage itself. It lies in what we call bone marrow lesions, or BMLs. These are basically areas of marrow swelling, microfracture, and scarring located within the subchondral bone. That's the deep layer of bone sitting directly underneath your joint cartilage. Studies show these lesions strongly predict exactly how much pain a patient will feel and how quickly their cartilage will break down. This proves that severe osteoarthritis isn't just a cartilage problem on the surface. It's a deep bone problem.
And the modern medical consensus perfectly captures this shift. There's a great understanding now that osteoarthritis is a disease of the entire osteochondral unit. The whole joint system is involved. When that deep bone starts experiencing microfractures, abnormal blood vessel growth, and inflammation, treating only the superficial joint space with a standard injection is suddenly highly insufficient. It's just not going to cut it.
So, if the problem is deep in the bone, the treatment needs to go there too, right? Welcome to Section 3, the deep bone solution, intraosseous PRP. Now, what's really interesting about this slide is the vital difference between these two approaches. Standard IA-PRP, or intra-articular injections, are delivered into the joint fluid. They target synovial inflammation and superficial cartilage. Think of this like replacing the damaged floors inside a house. Sure, it looks better for a bit, but IO-PRP, or intraosseous injections, are delivered directly into the subchondral bone underneath the joint. This targets the deep osteochondral unit and those painful bone marrow lesions we just talked about. In our house analogy, IO-PRP is going straight into the basement to fix a crumbling foundation. So how does this biological foundation repair actually happen inside your body? Let's zoom in on Section 4. How IO-PRP works, cellular mechanisms. There's a really cool rule of 3 when it comes to the biology of IO-PRP. First, it modulates mesenchymal stromal cells, or MSCs, basically shifting them away from creating inflammation and toward a more regenerative, healing state. Second, it regulates abnormal bone remodeling, helping to repair that disorganized deep bone and those microfractures. And third, it reduces the abnormal growth of blood vessels and nerve fibers into the deep cartilage. That third point is absolutely crucial, because those invading nerve fibers are a massive driver of the severe pain signals patients are feeling. The beauty of biology is how interconnected it all is. So the crucial point is this: by normalizing the abnormal turnover happening deep in the subchondral bone, IO-PRP indirectly benefits the cartilage sitting about it.
Fixing the deep bone actually helps preserve the overlying cartilage through what researchers call osteochondral crosstalk. Basically, when the foundation stops crumbling, the floors stop warping. It just makes sense, right?
Now, biological theory is absolutely fascinating, but we obviously want to know if it actually works in real life. Let's pivot to Section 5, clinical evidence, real-world results.
To ensure we are grounded in solid, systematic data, the researchers utilized a really rigorous PRISMA structured literature review process. They meticulously screened down the existing literature to synthesize 22 high-quality primary studies, which includes randomized controlled trials, observational data, and preclinical models, focusing primarily on the knee and the hip. And what did those 22 synthesized studies actually reveal? Well, the randomized controlled trials confirmed a powerful synergy. Combined injections, meaning getting both the traditional joint space injection and the deep bone injection at the exact same time, consistently outperformed the joint space injections alone. Patients who got the combined treatment experienced significantly greater reductions in pain and stiffness when they were checked on at the 6 to 12-month marks.
And this brilliantly illustrates the real-world impact, 78%. In one highlighted pilot study, an impressive 78% of patients exceeded the minimal clinically important difference threshold following that combined treatment. This means their improvement wasn't just some tiny statistical margin on a spreadsheet. It was a profound, highly noticeable enhancement in their daily function and pain relief.
Now, part of really understanding the science is recognizing what we don't know yet. Looking at the current limitations neutrally, a lot of clinical studies right now have pretty small sample sizes. There's also a definite lack of standardization. Different clinics use different PRP formulations, like leukocyte-rich versus leukocyte-poor. Plus, most studies only tracked patients for 6 to 12 months, meaning we still urgently need long-term data. And lastly, very few trials included sham-controlled or placebo arms, which is always an important factor to consider when we evaluate any pain relief intervention.
But even acknowledging those limitations, the current data is just incredibly compelling. Let's summarize this paradigm shift in Section 6, the future of joint care. Let's move to and see how this builds into a truly comprehensive joint preservation strategy. IO PRP represents a biologically grounded, highly targeted approach. It aims right at the structural and symptomatic root of osteoarthritis, the subchondral bone, rather than just trying to mask the surface pain. By addressing the osteochondral unit as an entire system, this technique has the real potential to significantly delay the need for massive, invasive interventions, like total joint replacement surgeries. So I want to leave you with this final provocative question. If we can successfully heal joints from the deep bone up, modulating cells, stopping abnormal nerve growth, and fixing microfractures with our body's very own plasma, how will biologically guided joint preservation change the future of aging? It's a massive question that really redefines what mobility might look like in our later years. Thank you so much for joining me to explore this incredible research and keep seeking to understand the science that shapes our world. Catch you on the next explainer.